Prostate cancer is a high-burden disease, with about 1.4 million new cases and roughly 400,000 deaths each year worldwide. It's also highly heterogeneous, around 30 to 50% are indolent. The key clinical challenge is identifying clinically significant disease that truly needs treatment. During a short consultation, clinicians have a high cognitive overload and they must integrate MRI findings, PSA and staging, comorbidities and functional status, and patient quality of life priorities to recommend the right treatment for prostate cancer. Current prostate cancer care pathways have important gaps. Standard biopsies can miss 20 to 30% of clinically significant cancers and carry procedural risks, including infection and patient anxiety. MRI interpretation and downstream treatment decisions remain variable and often depend on reader expertise. Although evidence-based guidance such as NCI-PDQ is available, applying it to an individual patient in real time is cognitively demanding. As a result, patient preferences are often under-integrated. Our goal is to use MRI to estimate the risk of clinically significant prostate cancer non-invasively, and then combine that assessment with clinical context and patient preferences to support treatment planning. This can reduce unnecessary biopsies and overtreatment by improving risk stratification upfront. It also enables more personalized, patient-centric care, with clearer discussion of treatment trade-offs in real time. Ultimately, the broader impact is lower clinician cognitive burden and more consistent, guideline-aligned precision oncology. Our solution has two stages. We begin with biparametric MRI inputs. These are first cropped and pre-processed to isolate the prostate region of interest. From there, MedSigLIP performs slice-wise feature extraction. And these features are then aggregated. A logistic regression outputs the probability of clinically significant prostate cancer. That risk estimate then feeds into the second stage on the right, where we combine it with PDQ guideline, structured clinical inputs, comorbidities, and patient preferences. MedGemma then generates evidence-based, personalized treatment recommendations, and also supports an interactive interface for real-time discussion during consultation. This is a demo of our clinical decision support system. The clinician reviews multi-parametric MRI and clicks to run the classifier, which provides a non-invasive prediction of clinically significant prostate cancer, including uncertainty. Next, the clinician reviews the structured clinical inputs, such as TNM stage, PSA, comorbidities, and patient preferences, and submits them to the recommendation engine. MedGemma then generates guideline-aligned, personalized treatment recommendations, with ranked options and supporting rationale. We can also open the detailed recommendation view for a deeper explanation of each option. The clinician then uses the interactive assistant to ask a follow-up, what-if question, and MedGemma updates the reasoning in the context of the same patient. This chatbot serves an interface for patient-centric discussions during consultation. Finally, the system produces a clinical decision support report that consolidates the imaging-based risk estimate, clinical context, and treatment recommendations into a single summary. Our CDS system addresses two core needs in prostate cancer care, reducing unnecessary biopsies through non-invasive MRI-based csPCa risk estimation, and generating explainable, patient-specific treatment recommendations grounded in guidelines. It is implemented as a full-stack web app with two complementary AI components: MedSigLIP for risk prediction and MedGemma for ranked recommendations and an interactive clinical assistant.